Welcome to this explainer. Today we're going to completely flip the script on everything you thought you knew about arthritis. We're diving deep into the fascinating, incredibly empowering new science of joint health after 60. If you've been feeling like your joints are just sort of inevitably failing you as you get older, you are definitely going to want to stick around for the evidence we've mapped out for you today.
You know, millions of older Americans have this exact, deeply frustrating conversation with their doctors every single day. It essentially reduces our joints to nothing more than rusty mechanical hinges that are just doomed to break down over time. You've probably heard this phrase, wear and tear, and like a lot of us, maybe you've just accepted it as an unavoidable truth of getting older.
But here's the thing. That whole wear and tear myth completely ignores a massive paradigm shift in modern medicine. This conventional wisdom isn't just oversimplified. It's actively causing preventable harm because it leaves patients feeling totally powerless. The real truth actually puts the control right back in your hands. But to get there, we need to clear up some major misconceptions first.
Section 1. Two very different diseases, osteoarthritis versus rheumatoid arthritis.
Okay, let's dive into this. Osteoarthritis, which affects a staggering 32.5 million Americans, is absolutely not just mechanical wear. It's an active, dynamic, inflammatory disease of your whole joint ecosystem. On the flip side, we have rheumatoid arthritis, which affects about 1.5 million older Americans. Now, this is a highly aggressive autoimmune condition where your own immune system attacks the joint lining, and it can actually trigger severe systemic effects throughout your body, like cardiovascular and lung disease. They get confused a lot, but their biological blueprints are completely different.
Section 2. The real culprit: inflammation and metabolic health.
Since osteoarthritis is by far the most common form, let's focus there and shatter this idea that it's just passive mechanical deterioration. The real key here is something called synovitis. Long before you can even spot cartilage loss on an X-ray, your joint is already suffering from this state of chronic, low-grade inflammation. The tissue lining your joint capsule isn't just wearing away passively, it's actively producing inflammatory cytokines. Think of them as microscopic demolition crews that are actively breaking down your cartilage.
And you know, the destruction doesn't just stop at the cartilage. Even the subchondral bone, that's the layer of bone right beneath your cartilage, turns into a battleground. Instead of just sitting there, this bone is heavily remodeling itself. It forms bone cysts. It develops osteophytes, which you probably know as bone spurs. These aren't just innocent byproducts of friction. They are actively releasing signals that speed up joint destruction.
Now get this, because this is really fascinating. The danger isn't just localized to your knee or your hip. It's actually systemic. It turns out your metabolic health is totally intrinsically linked to your joints. Metabolic syndrome, which includes things like visceral fat and insulin resistance, independently drives joint inflammation. Excess visceral fat literally produces inflammatory signals that damage your joints. It's exactly why you can get severe osteoarthritis in your hands and wrists, joints that don't even bear any body weight. The inflammation is actually coming from within your metabolic system.
Section 3. The pain disconnect. Understanding your arthritis pain. Have you ever wondered why someone can have extreme, debilitating pain, yet their X-ray looks completely normal? Or why someone can have agonizing pain even after getting a brand new mechanical joint replacement? Well, here is your answer. Central sensitization is this invisible neurological culprit. Your central nervous system essentially turns the volume dial on pain way up. It hypersensitizes you to signals, meaning your brain perceives massive pain regardless of what's physically happening inside the joint.
And this pain amplification doesn't just happen out of nowhere. It's radically driven by chronic, poor sleep, depression, anxiety, physical inactivity, and your body's overall inflammatory burden. This is a total game changer. It means that treating your mental health, moving your body, and prioritizing your sleep is just as medically important as treating the joint itself. You literally cannot solve a nervous system problem with a new mechanical hinge.
Section 4. The evidence-based treatment toolkit, moving beyond pills.
So, now that we know arthritis is this complex, inflammatory, whole-body issue, let's look at the actual evidence for treating it. When we compare our two main approaches side by side, the risks become incredibly clear. On one hand, we heavily rely on NSAIDs like ibuprofen and naproxen. Yes, they give temporary relief, but they carry massive hidden risks for older adults. We're talking GI bleeding, kidney injury, and even a higher risk of heart attacks. Worse still, they merely mask the pain while the disease keeps physically progressing. But then, look at targeted exercise. 0 GI risks, 0 kidney risks, And it actually modifies the course of the disease by strengthening muscles, pumping fluid nutrition into the cartilage, and physically dialing down that central nervous system sensitization we just talked about.
You might be thinking, okay, well, I'll just take acetaminophen. That's way safer. But the data here is genuinely shocking. Even acetaminophen, which is basically touted as the perfectly safe alternative for older adults, has been proven by multiple systematic reviews to offer barely any real relief. For knee and hip osteoarthritis, its pain reduction is practically marginal when compared to a sugar pill placebo. It's honestly astonishing how little it actually helps.
So if popping pills isn't the answer, look at the sheer physics of your own body. This number is wild. 4. For every single pound of body weight you lose, you remove exactly 4 pounds of crushing mechanical force off your knee joint with every single step you take. Losing just 5 to 10% of your body weight yields a disproportionately massive reduction in pain and joint loading.
So here's your actual evidence-based game plan for relief broken down into 3 definitive steps. Step 1. Combine aerobic exercise with strength training to stabilize your joints and push nutrition right into the cartilage. Step 2. Adopt a Mediterranean diet and take 2 to 4 grams of omega-3s every day to literally starve the systemic inflammation that's feeding your synovitis. And Step 3. Optimize your sleep and consider cognitive behavioral therapy to calm down your hypersensitized nervous system. This toolkit directly modifies the disease instead of just slapping a chemical Band-Aid on it.
Section 5. The future of cartilage repair, regenerating living tissue. For decades, the medical community told us that cartilage could never, ever repair itself. But a groundbreaking 2021 study blew that myth completely out of the water. It sounds like science fiction, but it's pure biological fact. Under the right conditions, the adult cartilage cells in our bodies can essentially turn back the clock. They can reactivate a fetal cartilage repair program, creating the same kind of collagen proteins found in an embryo. This regenerative capacity is especially active in our ankles and our knees. Your cartilage isn't just dead tissue. It's just waiting for the right signals to heal.
So how do we actually send those healing signals? Well, clinical trials are showing that targeted nutritional and regenerative interventions can stimulate this exact matrix production. Feeding your cartilage 10 to 15 grams of hydrolyzed collagen daily, co-supplemented with vitamin C, delivers the specific amino acids your joint cells desperately need. Plus, platelet-rich plasma, or PRP injections, which use concentrated growth factors from your very own blood, are showing incredible promise in rebuilding joint health, far beyond what a temporary steroid shot could ever do.
Section 6. Taking back control, a new blueprint for joint health. What all of this incredible data tells us is beautifully empowering. Arthritis after 60 is absolutely not a passive death sentence for your mobility. It's a dynamic, highly modifiable condition that responds remarkably well when you finally stop just masking the pain and start addressing its true metabolic and inflammatory roots. Your joints are living, breathing tissues that respond exactly to how you choose to live. They aren't just wearing out. They're waiting for you to change the environment they live in. So, armed with all this evidence, the only question left to answer is this. Are you ready to stop treating your joints like rusty hinges and finally take back control of your health?